DTHF Dialogues, Voices for Health, Equity and Innovation.
Everyone, my name is Lynn Bust and my pronouns are she, her, and they, them. I'm the Research Project Manager for the LGBT Health Division of Desmond Tutu Health Foundation. I'm here today at our head office with Lilita. Lilita, very happy to have you here. Can you maybe just share a little about yourself and why you're at our head office today with us?
Hi everyone, my name is Lilita Singata. My pronouns are he, him. I am a transgender man and I am here today at the DTHF head office for a screening of my documentary, Mirror Him, which the DTHF sponsored 2 years ago. We did it last year, 2 years ago. And it's about my medical transition and my social transition as a trans man. So basically it starts with me just as I was starting to transition. I talk about my relationship with my family, my mother, and with friends as well, and how it's changed and just navigating my relationships as I was medically transitioning. And also I just might mention there. Do I mention? Okay, you can see the changes. You see the changes. I was very excited about that. But yeah, that's why I'm here. We were screening that documentary today with the DTHF. Yes.
Thanks, Lilita, and it really is an excellent documentary. It's a 20-minute documentary that Lilita bravely shares their story and you kind of get an insight into Lilita's life. But if you maybe just want to share a little bit, I think particularly thinking around your social transition and kind of what has your experience been with your family and friends, and if perhaps you have any messages for family and friends of transgender people or people from the LGBTQ community, what message would you want to share with family and friends to support them?
Okay. So with my social transition, first it was very difficult for me to come out or like just to tell my mom that I'm going on this journey and I'm going to just start taking testosterone. I told her only after I had started, about 2 months afterwards, because I just didn't trust that she would allow me, um, which was very difficult because yeah, I just didn't trust. I didn't trust a lot of people with it. But then it's very important. I think it's very important for everyone to find like their people or people who are going to listen to them and understand them, family members who are going to be more open, as well as friends, before or when you're going to go on this journey, especially. Eventually, I did tell my mom, and she was at first very not so okay, but as the time went by, um, things got better because we would talk about it, and I was learning about myself and she was learning about me, and I was also growing. There were things that I was doing that I wasn't supposed to do, and her being able to see me not doing those things, um, it just helped her to accept me as I am, and just be able to separate the bad things I do from me being myself. So I think it's very important that you find your people. Also with my friends, I try to educate them and tell them about this. A lot of them like to be like, Lilita, can you show us your documentary? Sometimes I'm afraid to show them, but yes, I always point them in its direction. It's on YouTube. And then, yeah, they understand a lot better. I had a friend, for instance, who was telling me that I will never be a man, wada wada. But then, after seeing my documentary at the first screening with the DTHF last year, he sent me a voice note, and he's a Subi man, and he sent me a voice note, and he was apologizing, and he was saying, oh, I understand the journey that you're on, so sometimes it does take time to get people to see you, to understand you. So you must try to be patient, but you don't have to take everything. Like sometimes just let them go. But yes, like it's a journey. It takes a while for people for some people to understand you or to see you, but there are some people that are, you know, I'm gonna say worth the wait, or you like nyamezela. Like there are some people that I guess like you can fight for them to be in your life, and you can just trying to make them understand. And there are some people who just will never see you, and that's fine. They can just go wherever. Yeah, but all in all, my mom supports me, which is the most important thing for me, because she's always been a person who's always been around for me. Like everything goes through mom. So for me, that was my biggest fear, and she supports me, and I appreciate that, and I'm just glad for that. And I have friends who I grew up with who are supportive all over in Johannesburg and in Cape Town back home. I have family who is supportive, some of which were watching the documentary online now. My dad's sister, people I didn't think would be watching it or wow. So yes, like those are things I didn't expect, but I'm just glad that I have that support from family, and um, them watching the documentary helps them to understand. I think, I hope so.
Thanks, Lilita. Thanks for sharing some of your journey with your family and friends. And if you'd also like to share a little bit about your medical transition and what your experience has been in accessing gender affirming care, specifically hormones in South Africa.
Right. Yeah. Okay. So when I started on the medical transition, I started at WITS RHI Clinic in Belleville, which was funded by USAID and PEPFAR. So when Donald Trump took away that funding, so that was in 2023 when I started. So I would get my hormones for free there, my testosterone. There was psychosocial support, so I would speak to the psychologist. Sometimes there was a therapist as well. I would speak to them. I would get my prep there sometimes initially before I started getting it from Fast Prep. Uh, they were giving me everything. Like I was set. I was pretty set. And so now in 2025, when Donald Trump took away that funding, the clinic closed, and I haven't been able to get my testosterone anywhere. Before the clinic closed, I got a vial of testosterone from this clinic, and I've been using it till now, August. Um, it's about to run out, so I'm gonna need to find another service provider to get my testosterone from as soon as possible before it runs out. But I'm also thinking about I need to go get my referral letter from Belleville, another clinic from VITS, but it's in Belleville. I need to go get my my referral letter from there, and then I need to take it to another service provider to try and get my testosterone from them. I've just been worried about how long that's gonna take. Will I need money to pay for it? Um, do I need to get my blood test done before I get testosterone? Because the last time I had my blood test done was last year, and then I got trouble. So it's so stressful, like trying to figure out where to go next, and am I gonna get like a social support there, but yeah, I've been planning on going to Plumstead here in Cape Town, which is close to where I live, to see if I can get my testosterone from there. But otherwise, this was great. Getting my testosterone from this was great. Um, the people there, they were supportive. The first thing they would ask when you walk in would be, what's your preferred name, what's your preferred pronoun, and everything was just, it was like they see you. So it was just great. So not having this is very tough.
Thanks, Lisa. Thanks for sharing some of that, and I think really highlighting the urgent need for the provision of gender affirming care services in South Africa. The funding cuts have had a huge impact, and you can hear how stressful that's been for you both I think mentally, emotionally and physically this has an impact.
Yes.
So urgently I think the public sector does need to step in and be able to provide those services, and some of what was shared by the people who had joined the documentary streaming was that as a queer person, as a transgender person, often you don't feel safe going to the public sector and accessing those services. So we really need, and I have to commend especially the Western Cape Provincial Department of Health in taking steps towards that. So we've been working with them as the LGBT Health Division to implement something called the South African LGBTQ Healthcare Quality Program. And really what that is it's a year-long program which is driving change within health systems, particularly the public sector primary healthcare facilities, to make them more LGBTQ inclusive. So that as a young trans person going to access care there, you are able to go and get all the services, the comprehensive services that you need, but particularly gender-friendly care. And hopefully my colleagues will also share a little bit more about the South African LGBTQ healthcare quality program and what that entails. But it's a series of 3 workshops, and Lilita has been joining us for the first workshop and sharing their lived experience in person. So just as a closing, I think it's been incredible to have you with us as part of our team for that. But if you'd like to share about what some of that experience has been like for you too, that would be great.
Thank you, Lynn. Yes, that's like one of like the highlights of my life, attending the surgery workshops and facilitating it with the DTHF facilitators. So yeah, literally highlight. Because I learned a lot there about sexual orientation and gender identity. So it's like opened up a whole new world for me, because I knew I was transgender, but then getting to understand what a trans person is, and getting to understand that me being transgender doesn't necessarily um, have an impact on what my sexual orientation is, which a lot of people confuse also back home. I had someone who was like, if you're transgender, then how do you like these people? Stuff like that. So it's very eye-opening. I get to learn a lot about myself as well. So it's been great sharing my lived experience, and also just seeing the reactions of the people I share with all the time. It's always different, and always refreshing. I really love the workshops.
Thank you, Lilita. We love having you there, and it really has just been such a pleasure to have you as a part of our team, to see you again and again so bravely and courageously share your story, and look forward to the continued partnership, and hoping that through this platform and your bravery that more young trans people will be able to share their lived experience, and that through sharing those lived experience and through people listening and hearing to those stories that we'll be able to continue this change as well.
Thank you, Lynn.